Thank you, Mr. Speaker and members. Members, this is a very, very important vote that we're going to take. It's probably one of the most important votes of the year, and for freshmen, it will be your biggest vote, very likely, of the year, and it's one that we've spent a lot of time talking about and thinking about, and it does impact a great many Minnesotans. It impacts every single person in your district and every person in the state, and it will for many, many years to come. This will pass. This will become law. The governor will sign this into law. And for many, many years, people will look back on this, and they will be dealing with this in future legislatures. And it sounds, on the face of it, like a really good idea. Marketplace to purchase health insurance as an alternative to a top-down government control health care idea. It sounds like a very appealing idea. I'm probably one of the few people in this body, probably along with Representative Atkins, who's actually purchased insurance and group insurance for other people. And for small businesses, it's really difficult. It's difficult to get more than one bid if you're going out to try to find health insurance or disability insurance or life insurance for your employees. It's really hard for small businesses in Minnesota. It's getting harder and harder every year. So when you hear about something like this, it sounds like a good idea. And a few years ago, when we were looking at this, I remember reading the Heritage paper, the Moffitt paper that came from the Heritage Foundation that really said this is a conservative idea and we need to look at this. And I took that to heart as somebody who wants to make it easier for small businesses in the state of Minnesota to purchase insurance. Because let's face it, right now, for many, many small businesses and families, individual insurance, you can't even buy it, or if you can buy it, it's not really health insurance, it's bankruptcy insurance. If you're paying $1,000 a month deductible, $1,000 a month premium, $24,000 a year, your first $24,000 goes to health insurance, and then you got to pay for everything else. That's not workable, and we know that that's not sustainable moving along. So probably I was more interested than anyone than a health care exchange a few years ago when we started looking at this. But then you look at the details and you say, how are we actually going to do this? How are we going to roll it out? And when you look at what other states have done, that's what a lot of what we do is we say, all right, who's doing this? We're the laboratories of democracy. We're going to try things 50 different ways. That's one of the first things that we do, and Representative Atkins has been talking about that. And he talks a lot about competition, he talks a lot about transparency, he talks a lot about trust. And it sounds very appealing. And Representative Atkins is a very appealing spokesperson for just about anything. And I always, I tell freshmen, beware of Representative Atkins. Because Representative Atkins can swoon you into voting for something, make something sound very appealing. It's like, 46 states already do this, we do this, it doesn't cost any money, it doesn't feel bad, it's going to be great. Oh, that sounds great. What did we just vote for? So Representative Atkins is very, very appealing. We got to be very, very careful because he's very good at that. But you got to be able to look under the details a little bit and just say, what are we doing here? So when Representative Atkins kind of reminds me of this Far Side cartoon. There's this, it's out in the Serengeti, and there's this zebra, and the zebra's laying dead. And in front of the zebra there's this lion, and he's on his back legs, and he's directing other zebras, and he's saying, move along folks, nothing to see here, move along. So you got to be a little bit careful. You got to look a little bit beyond the detail and say, all right, well, let's take a little bit of a look at this. Let's look at some of these things about competition. And there's a lot of folks on my side of the aisle, like Representative Davids, Representative Gruenhagen, Representative Albright, and others that know a lot about insurance, and I hope you really took that to heart. I don't serve on the Commerce Committee. I don't really understand the insurance aspects like they do. They do a great job. But I'm just going to talk a little bit about health care because that's something I have focused on in the legislature, and it's something that I'm a big fan of in the state of Minnesota is our health care system. I want to talk a little bit about competition. I want to talk a little bit about how we're going to move forward. Because competition is one of the ways that this has been said that this is a good idea because this is competition. But I would question whether this is competition between one provider and another provider for my small business friends, or whether this is competition between the government market and the private market. I would submit that it is competition between the government market and the private market, and that's a bad thing because that makes government bigger, and as government gets bigger in Minnesota, the quality of health care goes down and the price goes up. We know that is true. We want to talk about competition. Are we also talking about Minnesota competing with other states? We also said, hey, you know, we need to do this because if we don't do this right now, the federal government is going to come in here and do this for us. We heard that? We heard that? The federal government is going to impose a federal exchange if we don't do this right now. Well, we look at other states, as I said before when I spoke on this on the House floor, and we look at North Dakota, we look at Iowa, we look at North and South Dakota, Iowa, Michigan, Wisconsin, the other Midwestern states are not doing this. So you say, well, it can't be that if this is such a bad idea or to not go with this exchange on the deadlines that the federal government tells us that we need to do, that all these bad things are going to happen. If all of these other states are really not doing exactly what we're doing, do you really think that that is such a cataclysmic idea? I don't think so. When we look at competition, it's Minnesota versus other states. It's private versus public. It's not a good competition like we think about for trying to get better quality for our health care dollars. We look at transparency. Is this really going to be more transparent? I believe Representative Atkins says this is going to be the most transparent agency in the state. How could we have any more transparency? Well, who is watching these folks? I looked at another state. I tried to look at as many states as I could to see what has already passed. And in other states, they have an outside auditor that comes in and audits the books and reports back to the legislature. That seemed like a good idea to me. I offered that up as an amendment. That was rejected. But you might want to think about that. You might want to think, who is actually watching these 7 folks? And let's talk about transparency and trust. Let's talk about trust because we've got the best health care system in the country. We've got the best physicians in the country. We've got the best researchers in the country. And we don't trust them. We don't trust. Not one physician can be on this board that's going to decide how we're going to deliver health care in the state of Minnesota from henceforth. And you know, we're not supposed to talk about Obamacare, a.k.a. the ACA. We're not supposed to do that, but I'm just going to mention that because that's how we got this. It was passed at a federal level, not on a bipartisan basis, but on a partisan basis, rammed through with no Republican involvement, nothing reaching across the aisle. It was rammed through, paid a huge political price for the Democrats for doing so in 2010. Paid a huge price for doing that, paid a huge price for imposing on all of the country a health care system that we can no longer enforce, that's going to drive up our costs. So think about that, this came from. This came from Obamacare. This came from the ACA. It's imposed upon the state of Minnesota. And when President Obama rolled out the ACA in Chicago a few years ago, he talked to the delegates of the AMA, all the physicians that came and gathered in Chicago, his hometown. And he didn't say, you're the best physicians in the world, you are the standard of care for the world. He talked about how much better health care was in other countries. And that's what we're doing here. We're saying we know more than you do, doctors of the state of Minnesota, physicians, clinicians, research folks who come here from all over the world. We know better because we're legislators. You can't be on this board. There's a gentleman by the name of John Hicks. He's a doctor at HCMC. When the bridge collapsed, the people were brought out of the water. They were brought out in terrible condition. They were brought to HCMC. They didn't know what they were facing. They didn't know what kind of injuries they had. They had head trauma. They had surgeries. They did the best they could. They reacted with the best absolute training in the world. Nobody died at HCMC that was brought out of the water or off that bridge that day. And I talked to this gentleman, and I talked to a physician named Walter Glisich, who's a neurosurgeon who operated on patient after patient after patient after patient. Nobody died. And you know what they said? They said, Matt, everybody did their job. Everybody from the nurses, the paramedics, everybody did their job. They brought these patients here. Nobody died at HCMC. Everybody got treated. And it was an unbelievable feat and an unbelievable example of how these folks are ready for anything. They're the best in the world. They're the absolute best in the world. And we're saying to those folks, we don't trust you. Dr. Hicks, you can't be on this board because we don't trust you. Can you think of anybody in the state of Minnesota who's probably more qualified in terms of who should get care and how we're going to get care and how we're going to deliver care than these folks? Do you really think that there's anyone else more qualified in the state of Minnesota? But we're saying, doctors, we don't trust you. We don't trust you. The same folks that built the best health care system in the country and in the world, that is the envy of the world, we're saying, we don't trust you. We don't trust you. Politicians can be on the board. Union members can be on the board. We understand health care. We can do this. We don't trust you. That's not a very good message to send forth to the people who've really built the best health care system in the country. I think we can do better. Small business folks understand this is not going to help your position. We've got a position where we've got government versus private market. We're not going to help. I hope we do. I hope this works, but I'm not very optimistic about the chances of that happening. So members, as we vote this out and vote this forward, please understand that what we need to do is we need to think about improving this from henceforth, and I hope we can do that. These are the kinds of bills and these are the kinds of agencies that once they're there, they're very much permanent. So I know that that's going to be hard, but I hope that you all are thinking very clearly and very cautiously about your vote today. And I thank you for your time and listening to me here. And I ask that you do not support this bill.